Okay guys, the topic will be the heart, and let's start with the pericardium. So what is pericardium? It is a fibrous sac covering the heart. It has two layers, the outer fibrous and the inner visceral layer. That's a serous layer. Between the two pericardial layers, there is the pericardial cavity. Okay. The excessive collection of the pericardial fluid in these cavities leads to pericardial effusion. This is one of the clinical conditions. And now to put it in a diagram, that's the heart, the red color one the heart, the yellow one the inner visceral layer, the green one the outer layer, and the middle part blue will be the pericardial fluid. And now the pericardial sinuses. There are two pericardial sinuses. Okay. These are the spaces between the various layers of the pericardium. It's the transverse sinus, and the other one is the oblique sinus. Now we'll go on with the transverse sinus. The boundaries: anteriorly the ascending aorta and the pulmonary trunk, posteriorly the SVC and the superior pulmonary vein. This sinus is used for ligation of the vessels, that is the arteries, during the surgeries. And to put it in a perspective, let's take the heart, the aorta, the SVC, and the pulmonary veins. And if you put a finger below the pulmonary vein passing to the aorta and before the SVC, you get the transverse of sinus. And now moving on to the oblique sinus. It lies behind the heart, anteriorly lined by the left atrium, posteriorly by the pericardium, and in the sides you have the pulmonary veins. This allows the free expansion of the left atrium during increased venous return while exercising. And to put it in a diagram, those are the pulmonary veins and these are superior and inferior vena cava. And as you see, the gap between those four pulmonary veins will be the oblique sinus. And now we move on to the external features of the heart. There are three surfaces: anterior, posterior, and inferior. The anterior consists of the sternocostal surface, the right atrium, the ventricle, and the left ventricle. And now moving on to the posterior, it is the base by both the atrium, mostly the left atrium, and T5 to T8 vertebra. Inferiorly, we have the diaphragm, both ventricles. It has three borders. It's a right border, left border, and the inferior border. The right border is by right atrium, SVC, and IVC. Left is by the left ventricle, left atrium. Inferior is by the right ventricle. And apex of the heart is formed by the left ventricle located in the left fifth intercostal space, just medial to the mid-clavicular line. The important point is the sulcus terminalis, that is the right shallow depression present in the right border. That's easy anatomy for you. If you like this channel, please like and subscribe.